In this lecture, we will discuss motion artifact, including how it comes about, how it appears on the EKG, and how to minimize it. Motion artifacts can occur when the skin is stretched. This results in a change to the skin voltage at the stratum lucidum, which is the second layer below the surface of the skin. So if you look here, we have the layers of the skin, and what we're looking at is this right here, the stratum lucidum, which is that second layer below the surface of the skin. Okay, that's where we see the stretching of it that leads to these voltage changes. Now, motion artifact can be minimized with mild skin abrasion, with fine sandpaper, or by using gritty gel. Now, motion artifact can be from respiration, patient movement, or transportation of the patients. We will look at each of these cases now. When respiration causes motion artifact, this is considered a low frequency between 0.4 and 2 hertz and appears as a wandering baseline. Okay, so here's our respiration motion artifact. So here's the one, and it's a low frequency between 0.4 and 2 hertz. And notice how you have this wandering baseline. Okay, you can make out our QRS complexes here throughout, but notice how you pretty much have this baseline that is wandering, meaning it's going up and down. Okay, and this is what we have with these low frequency artifacts. Okay, so this one's due to respiration. And with this sort of artifact, to minimize it, you should check for dried gel, and you should consider mildly abrading the skin, and also consider having the patient take a deep breath, letting half of it out and holding while the EKG is being recorded. The next motion artifact can occur when the patient is moving. This is considered a low frequency artifact between 1 and 3 hertz. In such cases, you may also see the baseline wandering at times. Okay, so now we have the movement, or we're moving the patient, okay, and this is another low frequency between 1 and 3 hertz. And notice you can make out the QRS complexes, okay, here, so they're there, although sometimes you'll have this wandering baseline. Okay, so still some wandering baseline, and this is from movement. All right, again, you want to check for any dry gel, consider mildly abrading the skin, and ask the patient to lie still and stop talking while you're recording it. Okay, now this last form of motion artifact can occur during transport. Okay, this is considered a medium frequency artifact between 3 and 15 hertz. So again, this is the patient moving, and now this is when we're actually transporting the patient. Okay, so this is a medium frequency between 3 and 15 hertz. Okay, and notice that it's a lot harder to make out our QRS complexes in this case. Okay, maybe you have one here, possibly one there, okay, here, and so forth. Okay, if those are accurate, one maybe somewhere in between here as well. Okay, so anyways, those are, you can see that transport certainly can cause this artifact that makes it hard to make out anything. All right, going on there. So again, you want to check for dried skin. You want to consider mildly abrading the skin, and you want to stop the ambulance or whatever you're using to transport the patient to get a clean EKG. Okay, so hopefully that makes sense. So let's review what we discussed before we end here. So motion artifact, remember the skin stretches, and remember it's at that stratum lucidum layer, that second layer below the surface, and that's where we get the voltage change seen. Remember, we can see it in 3 different areas that we're mentioning here. We said respiration, movement, so the patient moving, or transporting the patient. The respiration and the movement are more low frequency. And with respiration, in order to minimize it, you want to use the gel, okay? Mildly abrade the skin, take deep breaths, let the patient let half of it out, and hold while you're recording the EKG. Okay, now with the movement, so the patient's moving around, again, you can use gel to minimize this. You want to mildly abrade the skin, tell the patient to lie still, and stop talking while you're recording this EKG. Okay, and then when you're transporting the patient, whether it's an ambulance or however you're doing it, okay, in a vehicle, you want to, you can see this transport artifact, where it's more of a medium frequency artifact, and in this case, to minimize it, make sure you're using gel, mildly abrade the skin so the electrodes are sticking well enough, and you want to stop the ambulance or whatever you're using to transport the patient so that you can record a clean EKG. Well, that's the end of this lecture. We discussed motion artifact, including how it comes about, how it appears on the EKG, and how to minimize it. I hope you learned something.